You're listening to the Play Therapy Podcast with Dr. Brenna Hicks, your source for centered and focused play therapy coaching.
Hi, I'm Dr. Brenna Hicks, the Kid Counselor. This is the Play Therapy Podcast, where you get a masterclass in child-centered play therapy and practical support and application for your work with children and their families. In today's episode, I am going to be reading from another seminal text called A Practical Handbook for Building the Play Therapy Relationship. And Landreth is one of the co-authors, as well as Giordano and Jones. And this is actually an older book. I'm actually going to check the date for you. This was published in 2005. So almost 20 years old, but really, really helpful. And because it's a handbook, it actually has some practice elements to all of the skills. So if you would like to work on some skills in a tangible and practical way, you may want to purchase this. Again, Giordano, Landreth and Jones, A Practical Handbook for Building the Play Therapy Relationship. And the topic of today's discussion is going to be things that we might do inadvertently in the playroom that can make the child feel that something is wrong. So that's going to be an interesting discussion. So I'm looking forward to that. But before we get into that, a couple of housekeeping notes. First and foremost, I'm actively signing people up for the August cohorts. So if you would like to train in the Play Therapy Professional Certified Program, you can schedule a discovery call with me at playtherapypro.com, and we are actively loading up the August groups. Secondly, wanted to let you all know that I got a really, really special email, and I've been trying to get permission to share some things of fellow CCPTers out there in the world. And Jonathan wrote me and gave me permission to read his email to you. So I wanted to let y'all hear what he sent me, and then I'll dive into the text. So the email says, Mrs. Brenna, this is what I call you as you ride with me in my FedEx truck daily. I love that. I'm finishing my graduate program in clinical mental health counseling at Liberty University and will graduate in December, and I deliver packages for FedEx. You deliver packages with me every week, and I am certain some of my clients also hear you in my truck. I started my program wanting to help adults, me too, ironically enough, wanting to help adults with anxiety and depression, but I soon became interested in working with children, although I've always worked with children at church. I started listening to podcasts and reading books about working with children, and I came upon your parenting podcast about a year ago, and then your masterclass podcast. This has been so helpful as I started working with children. I intern at a private practice in Ohio, where most of the counselors do not want to work with children. Doesn't that sound familiar? I'm learning so much, and your podcast has been so helpful. I love the CCPT model because it provides a framework for working with children and views them like I do. And it does provide a framework, y'all. This is the most amazing part of CCPT. There is a very clear, delineated framework for us to use. So, Jonathan, I'm so happy that you realized that. And then he closes and says, I'm almost caught up on the Play Therapy podcast and plan to listen to all the episodes again. Just want to thank you for all the training and advice you give to us who work with children. You've been so helpful to me and my kids. Jonathan. So Jonathan, thank you so much for that email. Thank you for taking me around with you in your FedEx truck and all of your packages to all of the people to whom you deliver. So special. And thank you all for reaching out to me. I really can't tell you how much it means to get random emails like that, and just to know that you all love kids and you love child-centered play therapy, and you're working so hard to be the best at it that you can be. And so thank you for letting me know the ways that the podcast is meaningful to you, and what a special email to get. So Jonathan, again, in Ohio as a FedEx driver, thank you so much. And I'm really looking forward to hearing from you after you graduate and see where life takes you in the arena of child-centered play therapy. All right, so let's get into the text here. Wanted to give you a couple of scenarios that they mention in the book that talk about the way that we can ineffectively use some of the skills that we know, and therefore the child gets the wrong impression or feels that something is problematic or wrong. So the first one I'm going to read is an example of ineffective reflection of content. So let's kind of make sure we're all on the same page here. The reflection of content is one of the reflective responses. So we always have three options, and we're always going to use one of those reflective responses when a child's in the playroom. So an ineffective reflection of content is one in which we say something that does not really align with what the child said to us, even if it is accurate for what's happening in the moment. So let me walk you through the scenario. So in the book, it says that the child looks at the bot bag and puts sand in the plastic cup. So you kind of have to envision this, okay? So the child's in the playroom looking at Bobo and puts sand in the plastic cup. As doing so, says, I'm going to poison his orange juice and then he will die. So a true reflection of content would be focused on what the child has said. In this example, the therapist said, you decided to put sand in the plastic cup. All right, so notice that is actually a tracking of behavior. It is still a reflective response, but the therapist says you decided to put sand in the plastic cup. So here's what the book notes. At this point, the therapist missed an opportunity to respond to the significance of Tyler's communication. The content of Tyler's communication was more significant than the behavior of putting sand into the cup. Acknowledging nonverbal behavior is an important response to use when a child is not communicating verbally. It lets the child know that you are present and care about him or her. So think about that exact same scenario now, and the appropriate response would be, you want the poisonous orange juice to kill him. And then the follow-up commentary is, which I think is probably very relevant for many of us, Tyler's comment may surprise some beginning play therapists who may find it difficult to acknowledge his statement. I wonder if you all can imagine a time when a child has said something and you feel uncomfortable or unsure about whether or not you should actually say it out loud back to the child. So many therapists, I think, actually would hesitate to say, oh, you want to kill him with poisonous orange juice. But the book goes on to say, avoiding this statement could communicate to Tyler that there was something, quote, wrong about his metaphorical play. So by not reflecting content back to him and by tracking behavior instead, we actually can inadvertently make the child feel that what he was playing out was somehow wrong. Because if we felt uncomfortable communicating it, there was obviously something uncomfortable about it. So that is an example of ineffective reflection of content and why we would not want to avoid saying something like that, because it can actually make the child feel that there's something wrong. So now let's talk about how our tone of voice and expression can sometimes also do that in a play session as well. So they address several different things here regarding tone of voice and our own expression toward children. So here are the 4 that they talk about. Sometimes therapists use a different tone of voice with young children. They might use a higher pitched voice or raise the pitch of their voice at the end of the sentence. This tone can communicate an attitude that the child is not capable. Okay, so that's point number 1. Point number 2, a monotone voice communicates lack of interest. The therapist who is being genuine allows his or her personality to shine. I'm going to come back to that. The therapist uses a conversational tone as is used with others in his or her daily interactions. So the goal here is we don't change the tone of our voice, and we make sure that our true conversational tone and personality are conveyed. I was on coaching calls today with people in the training programs, and I actually mentioned this on one of those calls today. So many therapists will say to me, oh my gosh, I have you in my head at all times. And I'm always like, what would Brenna say? What would Brenna do? And I actually really have an issue with that. I mean, I appreciate the acknowledgement, but what I want for every single child-centered play therapist in this entire world is to be uniquely, genuinely, and truly you. You're not trying to be me. You're trying to be you. And that's what this mentions here. The therapist who is being genuine allows his or her personality to shine. You should be using appropriate CCPT skills with your personality, not mine. So we don't want to raise the tone of our voice. Likewise, we don't want to have a monotone tone of voice, and we want our personality to come through. Okay, so here's where things can go a little wonky and the child can feel that because of our response, something is wrong. If a child is not excited and the therapist responds to the child in an overly excited voice, the child may think that something is wrong. And therefore, the child can distrust his or her own reaction since the child is not equally excited. For example, a child is looking for a baby bottle and finds it, but the child does not appear excited. The therapist responds, "Wow, you found it!" This response communicates a sense of excitement that the child is not experiencing and therefore may lead or structure the child's behavior. So here are a couple other examples to illustrate this point. The child is quiet and solemn while burying several people in the sand. So here's a scenario that might take place in the play session, right? Child is quietly and solemnly burying several people in the sand. An inaccurate reflection would be using a happy or excited voice stating, "You know how to bury the people in the sand." A more accurate response is, "You're burying them in the sand." You hear the difference. The child is quiet and solemn. That dictates the way that we respond because we're saying the same thing in both of those scenarios. There was a slight variation in wording, but we're still communicating that the child is burying things in the sand. So it was not the content that was the issue. It was the tone of voice and the emotion behind the way that that was conveyed. Okay, another example. The child looks mad and is hitting and kicking Bobo. So an inaccurate reflection would be in a quiet and sad voice. The therapist says, "Oh no, you're really letting him have it." This is essentially empathizing with Bobo's feelings. I see this a lot in my video reviews, y'all. We respond in a very prescribed way. "Oh no, yikes, ow." Oh, we have prescribed responses that are not aligned with what the child is doing or feeling or communicating. So in that scenario, child looks angry, hitting and kicking Bobo, and then the therapist goes, "Oh no, you're really letting him have it." Do you hear how there's almost pity for Bobo in that scenario? But the accurate response would be, "You're really letting him have it." Because the child looks angry and is hitting and kicking. Now, I guess the caveat, important to note, just because a child is hitting and kicking does not mean that they're angry. We have to be very careful that we don't go, "Oh, you're mad," just because a child is punching or kicking or hitting. That feeling and that behavior do not go together. It can, but it does not. So we don't assume anger just because we see behavior like that. But in this case, the child looks angry. The visual cue is there on the facial expression. So then we match with an angry tone. "You're really letting him have it." Do you see how children develop a greater understanding of their feelings and themselves when we reflect children's feelings and validate their experience with an appropriate tone of voice and expression? We have to mirror theirs. So if we are incongruent with our tone or our facial expression, the child thinks that there's something wrong, and or they distrust their own reactions, and or it can structure the child's behavior. So in both of these scenarios, with reflection of content and with tone of voice, we are theoretically using child-centered skills. So it's not a deviation of the child-centered model, but notice how not being attuned and fully aware of these differences and these nuances, the child ends up having a negative ramification there. So I'm really, really happy about this practical handbook. I think it was a lovely find. And yes, it's 20 years old, but the seminal works are the ones that gave us the model in the first place, right? So we have to pay attention to them and know them and use them in our practice. So I hope that you found that helpful. I hope you're enjoying the summer school series so far. And if you have thoughts on what you'd like to hear more about, specific topics or skills that you'd like me to look through the resources and read about those specific things, please reach out to me, Brenna at thekidcounselor.com. One final note, if you are looking for more CEUs, you can go to childcenteredtraining.com. And there are on-demand courses that I have done with Corewell. There are a couple of workshops that I did, as well as some live trainings, and those are available. Many more to come. We're actually working on all kinds of new content there, but there are 4 posted on there right now if you're looking for CEUs, childcenteredtraining.com, and it'll get you to the right place. All right, y'all. Love you so much. We'll talk again soon. Bye.
Thank you for listening to the Play Therapy Podcast with Dr. Brenna Hicks. For more episodes and resources, please go to www.playtherapypodcast.com.